So from the earliest days of our foundation, we've brought a deeply psychosocial lens to our work. And what's become increasingly clear over time is that mental health can't be understood or addressed in isolation. It isn't a silo, so for us, whether we're funding education, public health, human rights, we've just realized that we're invariably confronting trauma and mental health, not as a singular event, but as a systemic force. And this insight has led us to invest in approaches that not only acknowledge trauma and mental health, but seek to transform systems in which they're embedded. We believe our responsibility as funders is to support care ecosystems that restore this agency and affirm dignity in individuals and really enable both individual and collective healing. And, when I think about what's happening in the world today, we've got this cascade of intersecting and compounding crises. We've got armed conflict, forced displacement, ecological devastation, rising authoritarianism. And these aren't just political or structural phenomena. They're profoundly psychological. They fracture meaning and rupture relationships and undermine the basic conditions of belonging and trust for people. I think about our partnership, but our partners really reflect this understanding. We've learned from organizations like Trust Africa and the Zimbabwe Alliance what it means to build trauma-informed movements for justice. How do you address mental health for human rights defenders? We've supported Wandi Kweza in rural Malawi, where community health workers deliver holistic, family-centered care that recognizes mental health as integral to well-being. Schooner has worked in Jordan for the last 6 years, where we fund SAMS, the Syrian American Medical Society, and they deliver frontline care that integrates medical, psychosocial, and community-based support to Syrian refugees and their host communities.